After 10 months of this pandemic, exhaustion is a familiar companion for Central Illinois doctors and nurses. Good evening, I'm Amber Kriska.
And I'm Tyler Lopez. Thanks for joining us this Thursday night. The number of hospitalized COVID-19 patients has gone down, both statewide and locally, but they still remain high. Alex Menke today had a chance to talk with a local doctor for a frontline perspective in tonight's top story.
Doctors and nurses at Unity Point suit up and head to the battlegrounds each day.
It's important knowing that we're all in it together. The nurses, the respiratory therapists, the advanced practice providers, physicians, all of us. We're all down there in the trenches.
Unity Point infectious disease and critical care doctor Praveen Suhindra says the second wave of COVID-19 surges has been relentless. He says he's lost count of how many COVID-positive patients he's helped.
Certainly exhaustion and the sense that we need a little bit of a break.
Doctors say they have more knowledge about the virus than just 8 months ago, but it's still a challenge picking a treatment for the patient.
We go by the best information we have. Sometimes it's anecdotal from our colleagues at other centers. We discuss with the patients that we aren't quite sure that this particular treatment would work or wouldn't. But if we think it's reasonably safe, we have tried different therapies before.
The Unity Point doctors and nurses say they understand the fatigue when it comes to talking about COVID, but for them to do their jobs in the hospital, they need us to do ours outside. Suhindra says there is a light at the end of the tunnel now that a vaccine is coming, but warns the fight won't be over after the first vaccine is given out. Reporting in Peoria, I'm Alex Menke.